Everybody, Brandon Reid here with Heartland National. Thanks for having me on this morning. We'll have a little under 25 minutes here to go over this product today. For those of you who aren't really familiar with home health care, that's okay. We'll go over what Medicare covers for home health care and even more importantly, home health aid, what it doesn't cover for home health aid type benefits. And then we'll go into how this product can help. So a lot of people don't plan for stuff like this. They don't plan for long-term care when they really should be. They don't plan for even short-term care. This product is something that kind of we can work in there as a fallback. Not always as an alternative, sometimes in addition to their long-term care policy, but in a lot of cases as an affordable alternative or an easy to qualify for alternative to long-term care. When we're talking to a lot of people in their mid-60s, 64 turning 65 or 65 and older, a lot of these individuals, first of all, aren't going to be able to afford a long-term care policy at that age due to the premiums, but a lot of them are going to have health issues that keep them from being able to medically qualify for a long-term care policy. So this short-term care plan, short-term home health care specifically, is going to be an easy alternative for them to afford at 65 or older and to medically qualify through 3, maybe 4 health questions. Very minimal underwriting. This is a policy that we'll see as issue age is 40 to 85. All right, and premiums are even more affordable in that 40 to 55 demographic if you're planning way ahead, like you should be. But again, keeping those premiums affordable at 65 and older compared to long-term care. This is a benefit or a policy that will pay benefits for care received at home. So I'll get into that in just a moment, the difference between our home health care benefits and our home health aid benefits, but every one of those benefits has to be received at home. We'll have an option really for every budget too. A basic plan for a 65-year-old starting at about $21 and some change each month. A standard plan looking at about $43 a month at 65, and a complete package for about $47, actually exactly $47.57 a month at 65. So very affordable policies if we're getting them in there early. However, these are attained age-rated policies. Not like our hospital indemnity, where when you buy that at 64, you pay the 64-year-old rate for the lifetime. This policy is going to go up. The premiums will increase in 5-year age bands. And we'll go over that as well towards the end of the call. It'll still be a lot more affordable than a long-term care policy, even when these folks are 86, 90, 100 years old. To qualify for benefits on a policy like this, it'll look a lot like long-term care. They'll either have to have a cognitive impairment, like Alzheimer's or dementia, or they'll need to have a functional impairment that prevents them from performing 2 out of 6 ADLs without needing substantial assistance or supervision. The nice thing about this policy is our clients are going to be able to get that care when they're unable to travel to the nursing home or hospital or skilled nursing facility. They'll be able to get that that care at home, next to their family, right? Their loved ones, their pets. They don't have to say goodbye to their animals. They'll have access to their own refrigerator. They'll be recovering on their living room sofa or chair, recliner, maybe even in bed. And they'll have the access to care at home, to have licensed, certified professionals coming out to the house to perform these types of services we're going to dive into in just a moment. And although premiums are already quite affordable, we're going to help the agent make these policies even more affordable for the client by paying them every time they go fill a prescription. Whether it's a generic or brand name drug, they're going to receive a benefit check in the mail every time they send in those receipts for that prescription drug fill, whether it's each month or every quarter. Brokers on the call. I know there's LOAs on the call, but these benefits pay, or these commissions for agents pay on the issue of the policy. So just like you're used to with hospital indemnity, you'll be getting paid during AEP while you're waiting for those Medicare Advantage commissions to come in January. Just like selling any other ancillary health product, you're layering policies in the home, building trust in that client's house, oftentimes not just them, but their significant other or their spouse as well. That's going to help lead to better persistency and a much stickier book of business overall, helping you keep a lot of that Medicare Advantage business on the books and Medicare supplement business as well. At the time we launched this product, other companies were doing a 60-day home health aide benefit. We went ahead and doubled that when we launched our product last August at 120 days of home health aide benefit. That, to me, sometimes is more important than the actual home health care benefits, because Medicare doesn't cover anything when it comes to the home health aide side of things. Medicare does cover, Medicare and Medicare Advantage plans do cover, however, 8 hours a day and up to 35 hours a week of the actual home health care services. So they will pay benefits for you to have that physical therapist come out to the house, occupational or speech therapist come out to the house, but up to 8 hours a day and up to 35 hours a week. And of course, that all needs to get approved by the Medicare Advantage plan, the private insurance company that's administering those benefits. And sometimes they can be pretty strict about what is medically necessary and what's not. What Medicare and Medicare Advantage plans don't cover is 24-hour-a-day care at home. They don't cover custodial care or personal care like bathing, right? Getting dressed, toileting, cleaning, like doing the laundry or making the bed in the morning. Assistance with these things can be quite common, right? With our seniors as they get older. And we know a lot of our clients who could really use help with things like this that they depend on their family for or their loved ones for. It's nice not to have to depend on those folks so that they can keep up with their families, so that they can continue to work, so that their loved ones don't have to step away from making a living for their family to come help you with these types of things. Heartland National is going to allow that to happen. They're going to pay your clients cash benefits per day when they need that home health aide to come out and assist with these types of services. Not forever, right? But for 120 days built into that policy. You can see we've already been approved in a good 27 states here. We're still pending in 2, Colorado and Alaska. Some states can be pretty difficult in terms of getting a product like this approved. So there's just some states we won't be entering, and some states we won't be entering at all, some states that we won't be entering in the near future. So when it comes to underwriting, I said it earlier, you're going to have 3, maybe 4 health questions to qualify. It's not like we're dealing with a med sub, right? Life insurance policy, hospital indemnity even. We're looking to make sure they're not going to be on claim right when they purchase this policy, right? Or eligible for claim. We want to make sure they're not already needing assistance or supervision to perform their ADLs, making sure that they can control their own bowel and bladder function. Number 2, making sure they're not already receiving home health care confined to a rehab facility, nursing facility, or assisted living facility, right? These types of individuals are folks who could be on claim day 1. We need to prevent those individuals from being able to qualify for a program like this. And of course, what else do we ask? To trigger the benefits, we need to see if they have either a functional impairment or what? A cognitive impairment, like Alzheimer's, dementia, or memory loss. So that's our 3rd question, making sure in the last 12 months, they haven't been diagnosed as having prescribed medication for or received medical advice or treatment for Alzheimer's, dementia, or memory loss. So that's to apply for our basic or standard plan, the first 2 levels of benefit, but to apply for our most comprehensive set of benefits, we need to make sure and ask a 4th question, ensuring they, in the next 60 days, they don't expect to be admitted to the hospital, nursing home, assisted living facility, or to require home health care or have surgery. And that only applies to the complete plan. In terms of underwriting, we'll have a 6-month pre-ex on this policy and a 2-year contestability period. To expand on that, we won't pay for anything pre-existing for the first 6 months. We're going to look back 6 months prior to the effective date and enforce that pre-ex for the first 6 months. That can be pretty common, right? You have a client, you enroll in this plan, they pass all these health questions, and then they've known they've been needing to have this surgery, right? On their hip or their knee. They go have this surgery in the first 6 months. if they've been recommended to have surgery or anything like that prior to taking out that policy, we're going to see that when we go pull medical records. We're going to see those notes that they were advised to have a surgery, right? They go have that in the first 6 months. They try to file a claim that's not payable because, again, they were seeing a doctor for it 6 months before the policy started. Now, if they go have that surgery 7 months in, right after 6 months, that is a payable benefit. It wouldn't fall under that 6-month pre-ex. As long as, again, they answered all these health questions truthfully based on which plan they were applying for. We will make sure they answered all of these questions truthfully on any claims filed in the first 2 years by pulling medical records. Our home health care benefits pay for 360 days, okay? Per benefit period, I should say. So 360 days per benefit period in most states. Pennsylvania, however, does not have a benefit restoration. Every other state does. And what that means is if you have an individual needing one of these several benefits listed on the screen here, we are going to pay a cash benefit per day, $300 on the complete plan per day of skilled nursing care, $300 a day per day of physical therapy, speech therapy, or occupational therapy, again on the complete plan, $240 a day for wound care, enterostomal therapy, respirational therapy, and chemo. Just some examples. And we'll pay that benefit for 360 days. And we can pay a maximum daily benefit of up to $600 on the complete plan, $400 on the standard, and $200 on the basic plan. So even if, again, their Medicare supplement or their Medicare is helping cover 8 hours a day for 35 hours a week, these are cash benefits paid to the insured. If we can see some sort of bill, right, we can get a cash benefit paid to the insured, not to the provider, to the insured to help pay for additional costs, right? Maybe they have a home health aide coming out too. Our home health aide benefits are good, but maybe they can use some of this leftover cash from the home health care plan to help pay for additional costs in other areas. So we'll pay, again, a per day benefit up to a maximum of $6, $4, or $200 a day. After, let's say they've used up some of their benefit, 20 days, 30 days, 40 days, however many days of benefit they use. Once that client recovers, let's say they have a surgery, right, or a fall, and they receive care for a period of days. Once they have sufficiently recovered and no longer need care, their doctor signs off on the fact that they've sufficiently recovered and no longer need home health care or nursing care services for a period of 180 consecutive days, that's 6 months, we can restore their benefits back to a full 360 days. And they'll be eligible for another per day benefit per service up to those daily maximums. Again, to qualify for those benefits, though, remember, read it in the fine print below. They either have to have a cognitive impairment to trigger that or a functional impairment preventing them from performing 2 out of 6 ADLs. You're not just going to buy this policy and start getting that physical therapy at home because you want to get cash for it. You have to, pretty much meaning you need to be required to have that at home because you can't get it outside of your house. You've got functional impairments or cognitive impairments that make it very difficult for you to go get that care outside of your home. In addition, we pay 120 days of home health aid at either $50, $100, or $150 a day of care. Is this going to cover all of their costs? Probably not. So that's where I say that home health care benefit, it's paying cash to your client. So if Medicare is covering you 8 hours a day for 35 hours a week, you might be making money on that home health care benefit through Heartland National. Use some of that extra cash, right, to help pay for additional home health aid services. The home health aid benefit is great, but it is limited to 120 days. You will have the option to purchase more through one of our riders. Okay. Again, that's contingent on those same requirements, and it restores after 180 days as well. So these are 2 separate buckets: home health care, 360 days, and home health aid, 120 days. You have home health aid come out today, It's not going to take away from your home health care bucket. If you have home health care, it doesn't take away from your home health aid benefit of 120 days. Our only benefit with no pre-ex, right? And no contestability, right? This is a benefit that pays day one, regardless of if you're already taking medications, our prescription drug reimbursement. And we pay $15 every time that client fills a generic medication and $30 every time they fill a brand name. On our basic plan, we'll pay up to $360 a year. And on the standard and complete plan, we'll reimburse that client up to $720 a year. The big thing here I want to cover is, again, first of all, there's no pre-ex. Second of all, even if their cost on their medication or their copay is $0 or $5, we're still paying the 15 or the 30, just depending on whether it's generic or brand name. Even if there's no actual cost to the insured, it's a $0 copay, we still need to see a copy of the receipt showing the name of the drug, the fill date, the client's name, of course, and charges, even if the charges are $0. That will allow us to determine whether it's a generic or brand name drug and get that benefit paid. They say within 14 days. We've seen a lot of these RX claims being paid next day or even 7 days later. There's a check in the mail. But just remember, we have up to 14 days, our TPA, to get those RX claims processed and that check out the door. You'll be able to track these as well in your portal. We have a claims history tab under the policy detail page. Search that policy holder in your portal, open the policy detail page, and you can track when those RX claims are going out the door and if there's any required forms that haven't been submitted yet for something like that. Now, to file an actual home health care claim, there is a home health care claim form that is required. With prescription drugs, we have an RX reimbursement form. It's not required, but it is recommended just to help keep things organized for your clients. And you can download that from your portal, or again, if you don't use it, they can just send in those receipts with everything I mentioned on it. The nice thing about these riders is we don't ask any additional health questions to qualify for one of these riders. So if you have somebody who's struggling to get a hospital indemnity plan as a standalone due to medical underwriting, you can pivot to this home health care product and add it over here through the rider, answering again those same 3 or 4 health questions to get that coverage. Big thing to know here is this is built off, these premiums for these riders are built off of the same attained age chassis as the base home health care plan. So the rates on this hospital indemnity rider are going to increase in 5-year age bands, which again are in a couple slides here. I'll go over those. You'll see it's most flexible on our complete plan. You can add up to $300 a day, $100, $200, or $300 a day for 3, 6, or 10 days in benefit. We'll have a 60-day restoration on here for those benefits to restore and pay again. Let's say next period of care, they get another 6-day copay. We're going to go ahead and pay those benefits again 61 days later. This hospital indemnity rider is a little different from the standalone. It's not quite as flexible. It's not built off of those same issue age rates, and it does not include the $150 ER benefit that our Secure Advantage Flex policy does include, for those of you already writing that. The ambulance benefit is available at $100, $200, $300, $400, or $500 per trip. So a newly enhanced ambulance rider we've added here, paying up to 4 trips a year and 12 times in the policyholder's lifetime. That can pay 1 time a day. It doesn't have to be separated by 60 days. The ambulance benefit can pay once a day, just not 2 times in the same day. And then the home health aid benefit, in every state we're approved in so far, you can add an additional 60 days of home health aid. Okay? Every state that product's approved in so far, 60 days. So that would take you from 120 to 180 days, a full 6 months of coverage for home health aid benefits on top of their home health care plan. Remember, sell that home health care plan as a way to add additional funds to help cover anything beyond the 120 or 180 days of home health aid. You want to use some of that leftover cash to help fund some of that. Severe accident and accidental death. This is an easy way for a very affordable premium to add an additional $5,000 or $10,000 in accidental death to this policy for $3 a month at 65 for the $5,000 plan and $6 a month for the $10,000 plan at 65. We'll also pay a 25% benefit for a hip or knee dislocation or a hip or skull fracture. We'll pay a 5% benefit for all other fractures and a 10% benefit for knee ligament or meniscus tears. And again, all of that is included at a very low premium, which I'll show you here on the next page. Let me start with that base plan. We've got one more minute left, so I'll finish up here. With our base policy, you'll see at 65, that complete plan will run you about $47.57 a month. Remember, at 71, they're going to see an increase. Doesn't matter if they bought the policy at 65, 69, 70. At 71, on the anniversary of their policy at 71, they will take an increase and they'll be paying $66.56 based on their age. At 76, $97.07 on the complete plan. And you'll see down here at 86 is the last time they'll take an increase. They'll be paying $193 a month for that policy at 86. So if you have individuals on a fixed income who might not be able to afford something like that down the road, you may consider that standard plan, $139 a month at 86. Something that you know they're going to be able to afford even when they're a bit older, because that's really when they're going to need this policy the most. You want to make sure of that. And it's really not going to make much of a difference early on in that policy because they'll be paying 43 versus 47, just a few dollars a month difference. They'll pay the same on the RX reimbursements on both plans, standard and complete. So just remember, yes, although these premiums are increasing over time, even at 76, when I'm paying $97 a month, if I'm taking even 4 generics a month, I'm getting $720 back a year on my scripts. That's the equivalent of $60 a month in rebates. So I'm really only paying $37.07 at 76 for that complete plan out of my own pocket. And again, it only takes 4 generics a month to do that. I had a lady the other day who takes 10 generics and 1 brand name. She got $110 or $150 back for the generics and an additional $30 back on the brand name prescriptions. So Jackson, I don't want to go over time. I know I have a couple more riders we could go over pricing, but jump in your e-applications, everybody. You've got access to the agent portal. Log in with your writing and run some quotes.
Yeah. Thank you, Brandon. Everybody give her Brandon real quick. In the comment section, comment, let's go Brandon again. I think that's so funny. So, hey, Brandon, I know you had some other things that you could go over, bro. We may have you on again to kind of tie up some more on this. And I know we had some questions on the cancer products that they would love to hear you talk about too. So maybe we have like a miscellaneous day or something. You can come back sometime and kind of tie up some more on this and some on that other, and maybe even talk about the hip. Let me say this for my guys in the office, and if you're on virtually, I think as well too. If you cannot, if somebody's barely not getting, if they pass the underwriting for this and not the hip, this is a great way to still get those benefits. And as Brandon mentioned, if they're using it on their prescriptions to get those rebates, it's paying for itself. You see what I'm saying? And then they have that included hospital indemnity plan in it. It's really a great product. I wrote some of this last year, and a lot of it last year, when I couldn't necessarily get a hip. I was leaning the hip front forward, but I mean, this is a great product too. The other day, I wrote the hip and the home health care product because it's a great product to go with. And so, seriously, this is a great way to if you are getting hung up with underwriting. If they pass those health questions that Brandon went over, this is a great way to still get something in there. Brandon, there were some questions people had put in here, so I'm going to go in here. Let's see here. Kim said, true story, broke all 3 of my bones in my ankle this January. I couldn't do like 3 of the 6 ADLs. Dang, that's crazy. Kim said, do rates increase with age? We did find out it does at 5 years. But that's, again, it pays for itself. It's well worth it. And then there's some availability questions here.